motivation for this event really has been to make sure that we bring people that tend to work in their own silos, like legal and professional, digital, doctors, together in one room so that they can help to solve some of the biggest challenges that we face today around healthcare.
The Technology Strategy Board is there to help support and promote innovation in businesses. And we've been building a programme in healthcare over the last 7 years. The issue is that healthcare providers are very conservative. They very rarely have enough space to be able to do innovative stuff. And that's where the Technology Strategy Board gets involved.
And really, our sort of primary existence, or primary sort of responsibility, I suppose, is to try and connect startups and SMEs with those sort of commercial partners and with those sort of opportunities. And again, trying to enable people to sort of take advantage of those opportunities, but encourage innovation, grow businesses, realise commercial potential, add value to UK economy.
So we divided the space up into 7 zones, and in each one of those zones we had a facilitator. We had zones ranging from legal and professional to service design to collaboration zones to a whole zone which had investors. We had a routes to market zone. And people were just free to roam around and access the information and knowledge and hopefully make some really good connections that they can then input into their business and take forward.
It's important to run events like this because otherwise people will stay in silos. They'll think, I'm a digital person, or I'm a healthcare person, or my market is around materials. In an event like this, people can see that there's a crossover, that digital technologies are really important for the future of the healthcare industry. There's opportunity there. There are problems to be solved.
So we applied to the Clinical Excellence contest that was held in 2013, and that helped us to work with a challenge partner to develop this solution. I was particularly focused on the care sector to try and improve the quality and transparency of care in that sector. One of the big problems in the current health and social care sector is the need for service users and patients to remain independent because the costs of specialist care and accommodation are significant. So what we've tried to do is provide a tool for care providers to interact with service users who are socially isolated, to help them improve their independent living skills, and to also help communicate better with the family and informal caregivers. We're obviously sort of grateful and excited about sort of having funding to develop our product further, but also I see tomorrow sort of networking is a great opportunity. It's always good to see familiar faces and to make new connections with people in the industry.
The reason I'm here today is really just to learn more about what's going on in digital healthcare, to see how we as J&J kind of help out and support the initiatives within the healthcare and digital space. It's been very useful. I've met a lot of different types of people that are innovating in dyslexia to gaming, so really a broad spectrum across the digital space with a focus, of course, on healthcare.
What we want to try and do is, for example, set up a 360 video at the end of a patient's bed or at the end of our simulation suite, record in 360 video, put that into the Oculus Rift virtual reality software. You could then put these goggles on, stand at the end of the bed and feel as if you're fully immersed in a cardiac arrest situation, a bleed, and you can just look around. You can follow an anaesthetist, follow the surgeon, follow the nurse, and we can't think of anything that would be more immersive as a training tool than using this.
We've got a very well-established innovation panel. So what we're encouraging people to do is come to us with these new designs, new software applications, using technologies such as smart tablets and smartphones. And we want to see what we can offer both the community as well as inpatients. We want to improve inpatient care and try and keep people well in the community and not have to rely on the healthcare resources as much. I've got a very full pocket here of business cards, and there's some fantastic things on offer here today. And without a day like today, I would never have been introduced to the multitude of people and the diversity of people that have been introduced today. It's really worth coming.
2 issues came up. One was, how do we get into the NHS? How do we penetrate the NHS and get beyond pilots? My tip is, from day one, involve clinicians and the people that you're going to be working with. And the second aspect was business models. How are you going to make money from the products that you're developing? And again, from day one, think about the business model that's behind the service or product that you're developing.
Those of us who work in the NHS, there are a few smattering of clinicians around here, we will say we are digital by accident. Most of you here at this point in time are trying to make it digital by design. So you already have a core structure and you're trying to build digital applications around it that fits in and makes the thing work. Right information to the right patient, the right time, so on and so forth. I'm prepared to stick my neck out as a clinician who's done this for 35 odd years to say the time is now right to become digital by default.
For me, I would like to see what we can do to improve the marketplace. I think we've got a lot of work to do to make it a more functional marketplace. I think we need to build the community that will make that marketplace more functional. We need to teach and educate the challenge owners from the NHS and the big corporations how to ask the right questions that the small innovators and the startups that could potentially solve on their behalf. On the flip side, I think we need to educate and train up the startups to sell better into the marketplace. I don't think they understand yet the value and the propositions that the big challenge owners want them to solve. So there's an ask better and sell better challenge on behalf of the NHS and the big corporations, and there's a sell better challenge on behalf of the innovators and the SMEs. I think collectively we can help solve that and make it a better, more vibrant marketplace.
It's been a fantastic turnout today, so please stay tuned and we look forward to welcoming you again in the very near future.